welcome. We're just waiting a couple more minutes so that other people can tune in before we start the presentation. Hi everyone. So we're ready to start now. I'm so excited to be here. So let me just talk a little bit about who I am and the work that I'm going to present. So my name's Andrea Torres. And my family has ancestry to Colombia, indigenous ancestry to Colombia. I was born here. All my family's still in Colombia. Uh, Although unfortunately, colonization kind of took a lot away from us, and that's how I ended up here. A lot of the work that I want to do and that I am doing is to bring awareness to the indigenous diaspora that currently lives in New York City. And that's what this presentation is about. I'll be talking about some of the work that I did with UIC during my master's capstone that I just graduated with a Master of Science in Environmental Policy and Sustainability Management from the New School. So I reached out to the Urban Indigenous Collective this past year so that we can collaborate on a project. And luckily they said yes, so here I am. And the work that I'm presenting is based on the issues related to the health disparities faced by the indigenous diaspora in New York City. Where these disparities stem from, how to address them so that others may also be accomplices to promote health and wellness among the indigenous diaspora, and all of the contemporary issues that are going on, especially right now with COVID-19. So let me just get right to it. Okay, so the project is called Addressing the Health Needs of the Indigenous Diaspora from Latin America and the Caribbean in New York City. So just a little, I guess, intro to what I'm trying to do. So this is just the beginning. For all that are attending, I want to acknowledge that the presentation and the language used are not representative of the communication that is necessary for the indigenous diaspora from Latin America and the Caribbean, and that's something that I'm going to touch upon further. The intended audience right now that I hope to reach are service providers and organization leaders who work with the indigenous diaspora, either knowingly or unknowingly, so that they may understand the work necessary to cultivate indigenous health and self-determination in New York City. For any of the work discussed to have the value that I'm seeking, I would like to expand the work to be spearheaded by the voices of the communities comprised of the indigenous diaspora and create a presentation that's culturally relevant and useful to community members that takes into account language justice as well. So Para todos los que asisten, quiero reconocer que la presentación y el lenguaje utilizado no son representativos de la comunicación que es necesaria para la diáspora indígena de América Latina y el Caribe. La audiencia a la que espero llegar son los proveedores de servicios y los líderes de las organizaciones que trabajan con la diáspora indígena, sabiéndolo o no, para que puedan comprender el trabajo necesario para cultivar la salud y la autodeterminación de las comunidades indígenas de Nueva York. Para que la información discutida tenga valor, me gustaría ampliar el trabajo para ser encabezado por las voces de las comunidades de la diáspora indígena y crear una presentación que sea culturalmente relevante y útil para los miembros de la comunidad. Okay, so introducing the purpose of my project and a little bit of the background. So medical research and health services have historically been Eurocentric, leaving the needs of Indigenous people unmet or often even exacerbating existing colonial stressors. Complexities are then added when you look at factors such as identities of indigeneity, language barriers, immigration status, and differences of a colonial experience. The goal is to better understand the health needs of New York City metropolitan area's Indigenous people from Central America, South America, and the Caribbean, and the purpose is to ultimately help shape strategies and programming that serves this diverse population, especially in creating a guide for health organization to meet the needs of a wider group of Indigenous people. So data on Indigenous populations from Latin America and the Caribbean are not actively collected as such. Instead, these populations are agglomerated and erased under the label of Latino, Caribbean, or Black. To offset the lack of New York City specific data, this assessment focuses on available data on health disparities faced by Indigenous populations within their respective countries, and also looks at the Latino data in New York City. Interviews and consultations with Indigenous activists, organization leaders, and other community members provided a focused approach to Indigenous population data that the existing sources didn't provide. The interviews themselves were semi-structured and open-ended so that different topics that I may not have thought of were brought to light while I was conducting them. So just a little background on the colonial history of medicine and social work and how to decolonize health research is what I'm going to talk about now. So some examples of colonialism in medicine are the syphilis experiments in Guatemala and the birth control experiments and forced sterilization in Puerto Rico. A lot of us are aware of the Tuskegee experiments that happened here around syphilis, but one of the doctors that spearheaded that research here previously conducted experiments in Guatemala. And this was a violent attack on Indigenous communities because Guatemala is comprised of majority Indigenous people. They basically got illiterate Indigenous women to agree to experimentations without telling them what was going on. They infected them and they didn't provide appropriate treatment. And in Puerto Rico, similarly, they got women and they would withhold information about birth control, and they sterilized them and experimented on oral contraception as a way to safely test the pill before marketing it to the white women in the US, because in the researchers' eyes, the Puerto Rican women were expendable. They were seen as expendable bodies in expendable communities. And a lot of the health history looks like this. So decolonizing health and wellness is a very complex move that we have to make in regards to how we can approach health that won't further harm Indigenous communities. So to do this, we have to apply post-colonial feminist theory to understand this history, the gendered violence, the racialized violence, and the sociocultural context in which the medical field operates, and dismantle the impacts of colonial knowledge and the way science perpetuates this marginality and subalternality of Indigenous communities and Black communities that undermined Indigenous identities as well as their mental and physical well-being. And mainstream social work is also rooted in colonial theories and colonial practices that emphasize hyper-individualism, hierarchy, patriarchy, paternalism, and detachment, values that do not promote well-being or regard the understanding of collectivism among indigenous communities, both in their countries and here in the diaspora. So approaching health and wellness is a sensitive topic because a lot of times there's trauma associated with the medical field. So just looking at the effects of migration on health and well-being is an important place to start to understand the health impacts that are faced by the indigenous communities here in New York. So the first is indigenous identity. So when indigenous people from South America, Central America, and the Caribbean cross into the US, they're stripped of their indigenous identity and lumped together, as I previously said, under the Latino, Black, or Caribbean label. And just a quote that basically encompasses this is, the recognition of an arbitrary border dividing Mexico from the United States and Canada suggests that once an indigenous individual crosses the border into the US, they're no longer indigenous and therefore categorized as Hispanic, a label negating their indigenous ancestry. Related to that is racialized illegality. So the word illegal has been used as an identifier to marginalize indigenous immigrants because what is considered looking illegal often refers to looking indigenous. Indigeneity is then criminalized, with examples of incidents of white Americans calling the police on people for looking illegal, and even questioning US Native people's documentation status. An example is Representative Eric of the Navajo legislator in Arizona, whose documentation status was questioned during a protest in 2018. And then there's anti-Blackness. Afro-Indigenous people are rarely accounted for throughout Latin America, and their claims to reparations is delegitimized for being considered not indigenous enough. The myth of mestizaje, and for those who don't know what mestizaje is essentially being a mix of European and indigenous ancestry, and that's made as a way to attack indigeneity and create a hierarchy. So this myth is in South America, Central America, and the Caribbean is meant to uphold white supremacy through erasure of Black, Indigenous, and Afro-Indigenous people. This erasure impacts the false narrative that Indigenous people do not exist in the Caribbean. Thus, Afro-Indigenous people face health impacts due to anti-Blackness as well. And there's gendered violence. Indigenous women often come as refugees of extreme violence, but then face it on the journey here and upon arrival. Indigenous women are disproportionately more likely to be victims of intimate partner violence. The organization Raíces, that works with undocumented women, details stories that women face, such as violent rapes that leave them with internal injuries and PTSD. And once they arrive in the US, they're placed in detention centers and they're not provided medical care or mental health counseling. So I had an interview with a coordinator for an Indigenous organization here in New York City that works with a large population of Mexican Indigenous people and people from the pueblos. So some of the major issues noted in the interview is undocumented status. So the majority of Indigenous people that David works with are undocumented. And hubs of undocumented Indigenous people are in Sunset Park in Brooklyn, Corona in Queens, Mott Haven in the Bronx, Washington Heights in Manhattan, Coney Island in Brooklyn, and Port Richmond in Staten Island. So we have very large communities of Indigenous people living among us in New York City. And this lack of documentation leads to fear of interacting with organizations and officials to seek services such as health services, mental health services, or food resources, which leads to the issue of food injustice. So conversion to Western diets, such as high consumption of soda, leads to diabetes and high rates of diabetes among Indigenous people. Food that is accessible, both financially and location-wise, is of low quality, once again leading to issues like diabetes and heart disease. And undocumented Indigenous people don't have access to food resources like SNAP to reduce food insecurity. And there's health injustice. There's little to no access to culturally relevant medicinal plants and foods. Medicinal practices are criminalized, often leaving Indigenous people charged with malpractice or child endangerment for medicating their children in traditional ways. And there's language injustice, which is a barrier in receiving proper health services or understanding health information. So an example that I'll be talking about is with COVID-19 and the information that's pertinent and important to understand at a very quick pace. And if it's not accessible in a way that's just, it's not going to create health among the communities. And just continuing with the interview with David, some of the comments that stood out to me is the fact that Indigenous immigrants are rich in their knowledge. In his words, we have a lot to learn from their ideas on wellness and caring for the self and each other. So something that underlies health services needs to understand the fact that Indigenous people understand their health better than anyone else, and they need to be the ones organizing and spearheading the healthcare that's necessary for them. And while many maintain their traditional medicinal practices, they may feel embarrassed, criminalized, and they do it in private in silence, and they could end up in court for malpractice since they don't have adequate conditions. And we need the city to acknowledge the presence of Indigenous immigrants. New generations are being forced to forget the ancestry of their parents and just immediately focus on becoming Americanized and assimilating as soon as possible in order to survive. And that's a consequence of the racism and discrimination that prevails in this system and in this city. So to look at the disparities that are present in New York City, like I said, I was using New York City data on the Latino and Black population. So 35% of the non-citizen population in New York City is uninsured, but that number doubles for undocumented New Yorkers, meaning that they have minimal access to healthcare, let alone affordable healthcare. Heart disease and diabetes are still among the top 5 causes of death among all immigrants, including those from Mexico, Jamaica, and the Dominican Republic. In 2011, the Latin American population had the highest percentage of diabetes cases at 14%, and the Black population not far behind at 13.9%. Indigenous, Black, and Latinx communities are being hit hardest by COVID-19, as I mentioned, with the highest rates of hospitalizations and deaths in New York City. And undocumented folks have no means of financial survival with no work and no access to financial safety nets. And that was further exacerbated when the documented family members of undocumented people were penalized for their relationships by being blocked from receiving assistance such as the stimulus check, simply for being the spouse or child of an undocumented person. So undocumented Indigenous folks are being attacked from every angle right now by COVID-19 with inability to access healthcare, inability to access financial resources, and having their family members become vulnerable financially as well. So some of the core barriers to health, just to reiterate the main barriers: undocumented status, criminalization of cultural practices, language injustice, food injustice, and erasure of indigeneity. So some of the organizations that are serving the Indigenous diaspora in New York City, which are really great examples of the work that needs to be expanded, are the Quechua Collective of New York, which is focused on traditional Quechua arts and language. And because language isolation is a major issue in access to medical care, they provide an important service, an extremely vital service. So for example, during the COVID-19 crisis that we're going through, they've been using their social media platform to fill the information gap by sharing pertinent health information regarding prevention and identification of the virus in Spanish, Quechua, and Quechua. And next is the Mixteca organization. So they are a health organization, so they focus on addressing health, education, social, and legal issues faced by the Mexican and Latin American immigrant community in Brooklyn. So their programming is vast, and some examples of what they do are Know Your Rights workshops for immigrants, so that when they have to encounter, or if they ever have to encounter ICE officials, they know their rights, and they also help them prepare, so emergency family planning in the case of detention. And then there's something really important, which is mental health support for the impacts that come with racialized illegality and undocumented status. And a domestic violence support program for undocumented Indigenous women, because like I said, a lot of Indigenous women face extremely high rates of domestic violence. So having programming like this is vital to support the health and wellness of Indigenous communities by protecting and providing resources to the Indigenous women of these communities. And the United Confederation of Taino People. So they're the official organization for tribal registry for Taino, Carib, and Arawak Caribbean Indigenous people. And their mission is focused on the protection of the human rights, their cultural traditions, and sacred lands of the Caribbean Indigenous communities. And they are a forum for educational advocacy and to promote the spiritual, cultural, educational, health, economic, and social development of the Caribbean people and their diaspora. So the guidance for culturally relevant health services came about from the interviews that I conducted, both with the coordinator for the Indigenous organization that works with the Mexican immigrant community, as well as an interview with another urban Indigenous organization here in New York City. And that's centered around interorganizational solidarity. So building relationships among organizations serving the South American, Central American, and Caribbean diaspora is extremely important between other Indigenous organizations so that they know what work needs to be done, how health organizations can support culturally relevant health programming, and immigrant rights organizations that are knowingly or unknowingly working with Indigenous communities so that they understand what racialized illegality does for mental health, and as well as the health, medical, and social service centers that are working with these communities need to understand that immigrant Indigenous communities are large and existing here in New York City, and they need to provide all of these resources in a culturally relevant way with language justice in mind and understanding the historical context of health, medical, and social work and their impacts on Indigenous communities. And we also need to redefine indigeneity in the US to move away from limiting this definition to federally and state recognized tribes. So providing inclusive definitions that encompass the Indigenous diaspora. And a potential way to do this is making an anonymous registry of Indigenous people to self-identify by providing their zip code for resource allocation. And the reason that this is done anonymously is because of the issue of undocumented status and the fear around interacting with organizations, because a lot of Indigenous undocumented people don't want to be tracked because there's a danger in that. And anonymity creates safety and the ability for collection of data that is extremely vital and missing. Like I mentioned, there was no information that I could find. I had to piece together information from the data around the New York City Latino population because it's not collected. And it has to be collected to appropriately create the services that are necessary by and for the Indigenous diaspora in New York City. So recommendations for improving health and well-being. So like I said, Indigenous design services is the most important thing to have in mind because Indigenous communities are experts on their own health. Cultural humility is needed for culturally relevant services and programming. And Indigenous communities need to prioritize their most needed services instead of health experts telling communities what's more important. And language justice is extremely important, and it's done by providing more than written translations because yes, medical documents and legal documents are often provided in Spanish, but that's not enough. Verbal translations are needed because some people don't know how to read. Some people never learn to read Spanish. Some people don't speak Spanish. So verbal translations provided by members of their own communities are important to actually achieve the language justice necessary to promote health and well-being. And lastly, food sovereignty and land access. So some of the things that I mentioned are the inability to access medicinal herbs and culturally relevant or culturally important foods, which creates a myriad of issues, such as diabetes, heart disease, and just the lack of capacity to treat yourself when you don't have access to medical care. So food sovereignty and land access promotes the maintenance of traditional food and culture as a protective factor for health. Access to traditional food and medicinal herbs are integral to culturally appropriate health. Without access to obtain or grow medicinal plants, we're just perpetuating the forced assimilation into dominant health practices. And the benefits to land access are vast. I mean, increased food security, diversification of diets, a space for cultural and agricultural education, and a place for community building. And these are just a small number of all the benefits that come from promoting food sovereignty and land access. So thank you all for attending the presentation and giving me your time. It means a lot to me, and I would like to ask if any of you have questions. Okay. So just to answer one of the questions that was just sent. So that question is, for those that haven't completed the census, what do you recommend for those who are Indigenous? So that's a really great question that actually did come up in my conversations and in my interviews. And what some organizations are actually promoting is for Indigenous people from the Indigenous diaspora from Latin America is to actually fill out the identification of American Indian or Alaska Native, even though the definition is extremely narrow. There needs to be a change, and there needs to be identification of Indigenous communities so that appropriate resources are allocated to many of those communities. So just an example, I live in Jackson Heights, and we are considered one of the hardest to reach communities when it comes to the census. And the reason for that is because of the large number of undocumented people that live here. Also, there's a large number of Indigenous people. And one of the issues that came up with that presently is with COVID-19, the lack of preparedness in this community in Elmhurst Hospital, because based on census data, the population was much lower than it actually is, meaning that there was a shortage of, obviously there was a shortage of supplies everywhere, but because the resources weren't allocated properly based on the population, this created major safety hazards and health hazards for the communities that live here. So I think that filling out the census is extremely important, but at the same time, I'm not sure if the person asking is undocumented or not. I myself am not undocumented, so I can't tell you what to do for your safety and what you feel is right. But based on my interviews, it was suggested that those who are Indigenous should fill out the Indigenous category. So the next question is, in terms of language, where can those who don't speak English or Spanish go to get health services? So that's one of the major issues that was brought up, is language justice. And right now, a lot of the services provided are not provided in any other languages aside from English, Spanish, maybe French, Creole, and a couple, you know, Hindi, depending on the community, like my own. But I mean, as of now, the services just don't exist, at least here in New York City. And something that could be really powerful is to have organizations like the Quechua Collective, which focuses on language justice and translation services, or even the organization Mano a Mano, which provides limited translation in indigenous Mexican languages. Having a partnership that's funded by the city and or the health organizations or social work organizations that bring in people who understand indigenous languages and can provide quality and accurate translations is the only way that health services can actually be provided to those who don't speak either English or Spanish. Because then, aside from that, you're just leaving out entire communities from services that are vital to their health and well-being. Okay, so next question is, have you come across anything that hospitals can do to support Indigenous health and community? So I didn't actually speak to anyone that works at a hospital, so that's something that can definitely be further researched, because I would consider what I did more exploratory research, and there's a lot more of specific questions such as like what places like hospitals can do to support Indigenous health. And I myself can't speak for Indigenous people as a whole, because Indigenous communities are unique and diverse, and the needs are extremely varied. So I think that hospitals that maybe work in Sunset Park, that work with a lot of people from that are Mexica, maybe, they would need to consult with the community so that they can understand what they need, so they can understand what services need to be improved, expanded, or even founded that weren't considered health services for the hospital. But definitely a lot of these questions, a lot of the questions that you all are sending are really, really great for me to continue with this research, because I mean, this topic is extremely complex, and there's so many questions that I haven't even thought of or touched upon that still need to be talked about. And which is why at the beginning I made sure to emphasize the fact that this is the beginning. Like I said, this is just the beginning, and I want to get more feedback, either now or later on. Definitely give me more feedback so that this work can continue. Oh, look at that. So I have someone from Jackson Heights that wants to link up to strengthen the Indigenous community over here in my neighborhood. That's awesome. Definitely reach out, comment or email all your information. Absolutely, absolutely. I would love to do more work locally as well. Yeah. Okay, so the next question is, what are some examples of remedies that medical providers should be aware of, and how can those providers learn more? So, I mean, to learn more, there needs to be, like I said, the communities that are being served, so to speak, by these health services, they need to be more than just consulted. They need to be the ones actually shaping the medical services and practices that are supposed to be for them. So they're the only ones that can answer that question, you know? So, I mean, the number of Indigenous communities that live in New York City, I don't even know all of them. I only know a handful. I mean, we have some Nawa people living here in New York City. I mean, from all over Latin America and the Caribbean. And depending on where the medical provider is located, depends on what community you'll be working with, what the medicinal or health practices are that are important and to provide these services. So my only answer to that is reach out to the communities that you're working with, inform yourself if you, because you very well might be working with Indigenous communities. So find out if the person asking is a medical provider, please find out who you're working with. And that's part of being an accomplice is educating yourself on who you're working with and making them leaders in the process. Because like I said, I can't speak for the Indigenous communities that you all might be working with or serving, because I mean, my family's from Colombia, and Colombia alone has a vast amount of cultures, you know? So yeah, that's my answer for that. Sorry if it's extremely vague, but I don't want to overstep. I can't speak for other communities. Let's see. What is your vision for the future of Indigenous communities and their health in the future? So, I mean, my vision is, like I've been saying, community-led services. Indigenous communities as experts. I mean, having services that are shaped by communities is the only way that we're going to get the appropriate services for diverse populations. When you have medical professionals bringing in Indigenous people as consultants, that's not enough. Because at the end of the day, the medical professionals are usually white medical professionals or non-Indigenous medical professionals. They're the ones who ultimately make the decisions based on the consultations with Indigenous community members. So what we need is not consultation, but actual accountability, actual power to create change. So, I mean, my vision is literally health services by Indigenous people for Indigenous people, not consulted by Indigenous people. What would you recommend for non-Indigenous people or organizations to collaborate with Indigenous communities and organizations? Okay, sorry, I read that a little fast. Let me reread it. What would you recommend for non-Indigenous people or organizations to collaborate with Indigenous communities and organizations? So I would definitely begin by networking and just coming into the communities and talking to people. Not just coming in as, don't come in as an expert. Don't come in as you are the expert, you're the medical provider. No, you come in with respect. You come in understanding that they're experts on their health, and that's how you begin this process. Because there's been so many inequities, so much violence, so much mistrust that exists among Indigenous communities with organizations that health organizations, health providers, understandably so, as I mentioned, the history, and a history that continues. It's every day, it's recreated, this violent history in the medical system. So you have to build that trust first. Absolutely, you absolutely have to build the trust first and address the root issues as to why a lot of community members are apprehensive in collaborating with non-Indigenous service providers or organizations. So, I mean, you start by collaborating with organizations that already serve the community and understanding what those needs are, doing the research first, compensating the labor of community members who you want to help you with your services. So I think that building that trust, collaboration, interorganizational solidarity are all important so that you can break down those barriers in a way that's safe and in a way that doesn't overstep cultural boundaries. So I know that a lot of my answers are extremely vague, but that's, I think, one of the main takeaways from my research is that no one can speak on behalf of Indigenous communities. So, and that includes me, that includes even other Indigenous people who aren't members of the communities that they might be speaking on. I think respect of cultural boundaries is important to understand before coming in and asking for information. So speaking of food sovereignty and land, what are your recommendations for New York City Indigenous food sovereignty, and how does that get started? Who starts that? That is super difficult, both as a question and as a practice. I mean, there are definitely some organizations working on that. Not so much some in New York City, but you have organizations like Soulfire Farm in Petersburg, New York, who are a Black-owned farm and cultural center and education center for Black Indigenous people, as well as the local Indigenous communities to come in and use the land and, you know, have sovereignty over the land as well. And obviously in New York City, it's a lot more difficult because space is limited. There's green space is, you know, very, very minuscule. But there's still possibilities. I mean, reappropriating green spaces, reappropriating community gardens, land collectives, land cooperatives, I mean. So there's just different opportunities that exist onto how to create food sovereignty and land sovereignty in New York City. Admittedly, it's a lot more difficult to do so. But I think by creating cultural hubs that are kind of like on the same page, on the same boat, and trying to get land back, you get the power of the people. You get financial power by collectively financing cooperatives. For example, the Brooklyn Movement Center. So this is a Black organization in Brooklyn that is creating their own, essentially, like I would say, like their own grocery store for the community because of what's called food apartheid. So inaccessibility of food, low quality food, expensive food that creates health disparities among the Black communities in New York City, low income Black communities. So that's just a really great example of what can be done with a collective. So you have a group of people collecting money, getting grants, and then creating their own food source for their community to get healthy foods. So it's something that can be done, and we need to look at the examples that exist right now and what they did and how they got that success, so that it can be replicated and expanded horizontally, so that more communities can continue this kind of work. So next question. What can young Indigenous people do to get started and work with Indigenous health? What was your path? How did you get involved in this work? So my path came just very personal out of an identity crisis of my own. Having been born here in New York City, like I said, basically my entire family lives in Colombia. So I was very alienated from family members because they're living in a whole other continent. I was very alone. I have white family members. I have family members that are have more ties to their indigeneity, who are visibly more Indigenous, so they also experience the racialized illegality. My father is, there's no mistaking his Indigenous roots. I mean, he's several shades darker than me, long hair, Indigenous features, and he's experienced racialized illegality throughout his life. So I witnessed that. You know, I witnessed my own violence of, you know, I mean, being Latina, right? Everyone wants to call you Mexican. Everyone who's Latino is Mexican. And as I grew up, I started understanding, what does that mean? They're mocking me for being brown. They're mocking me for features that they perceive to be, you know, Indigenous, thus illegal. So I kind of started wanting to understand more about where I come from, my history, my roots, who I am. I'm not white. I'm not from this land. I have indigenous roots, but not from here. So it was kind of like in that struggle of understanding like who I was that I got a little bit more involved with like indigenous health, indigenous practices, some of the stories my dad would tell me. I mean, he came from a household where they consume traditional foods, a lot of corn, a lot of, you know, vegetables, fresh foods, healthy foods. And he came to the US and all he had to eat was like fast food because he had no money. The people he was staying with would take him to fast food places. So he was just eating junk food and he got sick. He got extremely sick those first few months because his body wasn't used to that. And that was a living example of what I talked about of the diet changes that come from the indigenous diaspora, having come from a place where they have access to fresh foods that is a protective factor for their health, coming here and consuming foods that aren't culturally relevant, that aren't culturally appropriate, and getting sick from it and getting a bunch of health issues from it. So I didn't have that personal experience because I was born here, but my dad talked about it. So that's something that got me interested in understanding the links between food and health, immigration and health, indigeneity and health. What New York City agencies or organizations would be most critical to changing their systems to better support the indigenous diaspora? So I think critically, just any health organization in New York City, public health organizations, absolutely. Uh, Even more so every organization should, even private health practices should. But realistically, a lot of the indigenous diaspora is coming into contact with social services, immigration services, or the SNAP program as well, for those who are parents to documented children who get WIC, who get SNAP. Um, Pretty much, I think there needs to be a documentation of what organizations come into contact with indigenous communities the most to understand which are most critical to change right now. But I think that that's something that needs to be further researched as well, so that we understand where to begin this work. And obviously, like I said, spearheaded by the communities. What organizations do they feel are most important? Is it the medical health organizations? Is it the social work organizations? Is it the food service organizations like SNAP or WIC? I think that like something that I mentioned is prioritization of what's most important. That needs to be defined by the indigenous communities themselves, because maybe someone like me would say, oh, maybe the medical field, right? But maybe that's not what's seen as the most pertinent right now. Maybe it's social services, or maybe it's even immigration services that's seen as most important by certain communities. So I think that needs to be defined by the communities themselves. And that's part of that self-determination of the services provided, is prioritization by the communities themselves. Any last questions? We have a couple minutes before we end the Q&A. Even any feedback, anything that you think that I may have missed and that you think is important. So if you could please, everyone who's attending and who is interested in what I talked about, if you could please provide some feedback on the survey that's being provided, so that I can understand what's still missing in the presentation, what you'd like to know more about, and how to basically grow this research and grow this work. So the survey is going to be located, let's see, let me just send that. Okay, it's already been sent out. So it's located in the Zoom chat as well as on the Facebook chat. So that'd be great. So Oliver and Alexis, thank you so much for attending, and thank you for just giving me your time and listening. So to contact me, you can definitely email me. I'll post that as well on the, I'll post my contact information on the UIC page in case there's any collaboration that anyone wants to do. So I'll have my professional email. So anyone who missed the chat, anyone who missed the webinar or missed any of what was going on, this information is also going to be posted on the UIC YouTube channel. Okay, and as well as the survey. But once again, I just want to thank everyone so much for their time, because I know time is valuable, and especially right now, and just giving me your attention, because this work is incredibly important to me and important to a lot of people, especially right now with everything that's going on. I want to acknowledge that, you know, COVID-19 is exposing all of everything that's going on that's lacking with Indigenous healthcare, and how the Black Lives Matter movement is also tied with Indigenous well-being, because Afro-Indigenous people are being targeted as well. And Black people, just Black people overall are being targeted. So I think that all of this ties together, and I think that this work needs to be, it needs to be prioritized. So thank you all so much. And I would like to acknowledge just all of the organizations that provided me with their time to be interviewed. I'm not going to say it out publicly because the interviews were done anonymously, so I don't want to basically break that anonymity. But if any of those who I interviewed are watching, just thank you so much for providing your input. And if you have any questions, please email info@urbanindigenouscollective.org. So that's info@urbanindigenouscollective.org. So any questions, any feedback, just go there and send your questions. But thank you so much, everyone.